fight back against COVID. Well, amidst the rise in the COVID cases and also the concerns over the new JN.1 strain, today the Health Ministry held a high-level meeting to review the preparedness of COVID-19. In fact, Union Health Minister Mandavia has held the review meeting virtually with the state health ministers amid the COVID surge during Christmas as well as New Year festivities. All present for the meeting agreed that the crowd management is going to be the main focus and the test, track, treat, vaccinate mantra is essential to all our steps.
इस मीटिंग में आज की कोविड-19 की जो सिचुएशन है उसका रिव्यू किया गया है। सेक्रेटरी साहब की तरफ से एक डिटेल्ड प्रेजेंटेशन उनके समक्ष लाई गई और ओवरऑल पिक्चर ये है कि देश में लगभग 2300 एक्टिव केसेस हैं। जो सिचुएशन मान लीजिए 1.5 महीना पहले थे उसके मुकाबले में बढ़ोतरी हुई है। पॉजिटिविटी भी कई जगह पे बढ़ी है। हमारे अस्पतालों की तैयारी, पीएसए प्लांट्स की तैयारी, क्रिटिकल केयर की तैयारी, प्रोटोकॉल्स की तैयारी और टीम्स की तैयारी पूरी होनी चाहिए। हमें सर्वेलेंस में ताकत और लानी है, ये उन्होंने रिक्वेस्ट करी है।
So which are the states which really should be on the lookout? Here we have mapped for you state-wise the kind of active COVID cases which are being reported over the last 5 days. First, starting with Kerala. Unfortunately, this is the state which has seen the sharpest of hike. In Kerala, 15th of December, there were 1,144 active cases. This caseload has now shot up to 2,041. The next in line was Karnataka. From 50 on 15th of December, the number of active COVID cases has gone up to 79. Across in Tamil Nadu, from 36 active cases, it's now gone up to 77. Across in Maharashtra, you have from 19, the number of active cases going up to 35. In Goa, now you can see geographically also how the spread is very, very visible in all of this. You have from 15, the number going up to 23. All these states, neighboring states where you can see this curve. But now what does this mean overall for India? Now remember, the numbers may not be alarming right now, but is this the beginning of the next wave? Well, that is the biggest worry. Watch this. On 15th of December in India, there were 312. Then steadily it went up the next day to 339. By 17th of December, there were 35. Then you had 260, a slight dip, and then it went up to 288. And look at this today. Today, on the 28th of December, there are as many as 614 active cases of COVID which have been reported, which is why there is a reason behind the entire pressing of the alarm button which has happened. So what really happened? The guidelines which have been issued and the curbs which are in place. Let's get you in the state of Karnataka, but also let's get you a quick ground report on whether or not the people are actually following this. Watch this report.
As there are talks of COVID cases coming back to India, is there a need for you to panic? Should you be worried? Well, the Union Health Government says not, but having said that, there is a need to be vigilant and alert. There was a meeting that was held today with all of the state health ministers, and in light of cases being reported, especially in Kerala, the state of Karnataka too has now in fact been put on an alert mode here. While there's no panic that's been created, the government has said that the state should be alert and measures should be taken. Now, the Karnataka government, in fact, has mandated the wearing of masks for 60+ people across the state, especially in crowded areas. Now, remember, we've always seen that senior citizens and those suffering from SARI or ILIs or respiratory issues have been the worst affected even in the previous waves of COVID. Now, while there may not be an alarming number of cases in Karnataka, a total of about 79 cases have been reported, of which 62 are in home isolation, is what the government has said. It is, of course, urged at this point in time that people try and avoid crowded spaces or claustrophobic or, areas, in fact, that aren't well ventilated. Because remember, even with the festive season right around the corner right now and possibly a huge migration of people from the neighboring states as well, there could possibly be a reason for concern, maybe at a later stage. But for now, it's important to keep your stand up, to keep your vigil up and ensure that you are a responsible citizen and wear your mask if at all you are in a crowded area.